Welcome to your infection control training session. My name's Derek Bampton. I'm one of the infection control nurses for the Trust. Infection control is really important to protect our patients and our staff from getting any infections. We want to make sure that everybody who works within our Trust make sure they have good infection control practice throughout the Trust, so we don't take anything home and we don't bring anything in. We want to make sure that you're aware of what your responsibilities are around infection control when you're out there on the wards, and that everything you do is there to protect the patients and yourselves. We also want to make sure you're happy with what you need to be seeing and what you need to be doing, so that when you see people doing it wrong, you're happy to challenge them and make sure that their practice is as good as yours, because that way nothing happens in the Trust that's going to cause a problem to the patients and you. The good thing around infection control is it is common sense. Everything we do in infection control is basic stuff. There's nothing complicated, so that's why we expect people to be able to check people doing it, because it's nothing difficult. If it looks wrong, it probably means it is wrong, and we should be challenging people to make sure they're doing it correctly. One of the simplest things we can do to prevent the spread of infections is washing our hands properly. To help us with that, the World Health Organization brought the 5 moments of hand hygiene. These are simple steps for checking that you're doing everything you can in the clinical setting. And the first one is about washing your hands before you go and see a patient. The second one is about washing your hands if you're going to deal with anything that's connected to that patient. The third one is when you're dealing with any body fluids, if you have to, then you must make sure you wash your hands afterwards. The fourth one is about doing your hands when you leave that patient. So when you finish what you're doing to that patient, you need to have washed your hands. The fifth one is about when we deal with the patient's belongings, the environment and the surrounding area to that patient, but we don't actually touch the patient. That's the one that probably gets missed the most within a hospital setting. So that one's key, because people don't think they touch anything, but they normally do touch something when they go into a patient's bedside. So please make sure you wash your hands after that. We will be doing a practical hand hygiene video that we expect you to do and watch. We will be also doing some training sessions into one of your days where you come along, and if you'd like to, come along. But on the wards they also do training sessions, so you can always go into any of those ones that they're putting one on. They're good fun sessions to do, and it really gives you an idea of how to wash your hands properly. The next slide is all about how to keep your hands clean. It's called bare below the elbows, and it's part of the uniform policy. Everybody that works in the Trust has to abide by that when they're in a clinical setting. You have to be in that clinical setting, you have to be bare below the elbows. When you need to wash your hands, you cannot wash them properly if there's anything covering up your wrists, your fingers or any part of your hand. So you have to make sure that you've got nothing on them. The only thing we allow you to have on is a single plain band wedding ring with no stones or fixings, because that way no bugs can get into them and stay there. If they do, you will be taking them home, and some of these bugs can last a long time, and we don't really want you to go home and get ill. So what bare below the elbows means, what you can't wear is nail varnish, false nails, multiple rings, friendship bands, wristwatches, or long sleeves. If you've got any of those on, please take them off before you enter the clinical setting. The next thing I'm going to talk about is isolation. We do put patients into isolation for 2 different reasons. One is they've got an infection that we don't want to get out, or they're very poorly and they've got more risk of getting an infection, so we don't want any bugs getting in. Unfortunately, these patients, when they're put into isolation, feel very isolated because nobody really wants to go in and see them. So if you feel happy to go in to an isolation room, check with the staff what they've got and what you will need to do. But please do go in and see them, because otherwise it's a very long day and very lonely for those poor patients. The next thing I'm going to discuss with you is a thing called the winter vomiting disease, or Norovirus. It comes round regularly every year. It's actually becoming more common during the summer as well as winter now, and it will close a hospital down if we don't protect from it. We will close bays down. We don't move patients out with norovirus into side rooms because there's no point. Everybody within that bay is now infected because when people vomit they spread it a lot. It will close wards down as well. If we do close a ward down or we have an outbreak, then please don't just not come in. Please ring the ward because they will need help at that time. It's a very busy time for them because they've got to do a lot more work within that area, and that your help could be invaluable to them. But if you feel unsure that you want to work in that environment, then please do still phone in because there are other jobs that can be happening. We could have you at the front entrance asking people to wash their hands as they walk through the doors, or manning entrances stopping people coming in, with support of course. The other organisms that cause diarrhoea is a thing called Clostridium difficile. This is a different bug. We will isolate people in a side room for that one. So you will suddenly find patients moved from a bay into a side room for that. That patient will be isolated. So again, you will need to check before you go into that area. The next thing I'm going to discuss is sharps and getting sharps injuries. Sharps are not your responsibility to deal with. The person who is using the sharp needs to dispose of them. We don't expect you to. But if you see some lying around, please make sure that nobody's going to get injured by them and get somebody, one of the senior nurses, to come and sort it out for you. What I mean by needle stick injury is if you get a scratch from anything that's sharp that might have blood or contaminants in it. So make sure it's safe and then get somebody to dispose of it for you. If unfortunately you end up with one of these needle stick injuries, then please do report it immediately. Don't wait any time. Speak to the nurse in charge. They will get you to go and do some basic first aid on it and then get you across to either occupational health during the working day or to A&E if it's out of working hours. They will then see if there's anything further needed to do, but you need to do that immediately because there's a short time scale for this and we want it done. Once that has all been done though, please come back and speak to the nurse in charge so they can help you fill out an incident form, because we need to understand how it could have happened and how we can stop it happening again, because we don't want these in the trust. The next slide is all about a thing called single-use items. This is a very easy concept to understand. It says on the box single use, and there's a number 2 with a circle around it and a line through it, which actually means don't use it more than once. Unfortunately, that concept seems to have lost a lot of people, and we find a lot of single-use items being used more than once. Scissors are the most common one. They're rubbish scissors, but they still want to use them more than once. Please don't. If they are single-use, then throw them away after one use, and if you see them lying around, please throw them away. The license for them is one use. If they break in your use, then you become the licensee, and I'd hate for that to happen to you. Next thing I want to discuss with you is cleaning of equipment. This is a very, again, simple thing to do. We make it as simple as we can because we have detergent wipes ready for you to use. You don't have to make up any solutions. You just get them out of the packet and wipe the equipment down. But please make sure that they're wet, because if they're dry, they've got no detergent on them, so just throw them away. When you're cleaning a piece of equipment, please start from the top to the bottom and get to a point where you can take the dirt away. When you finish cleaning a piece of equipment, please make sure you dry it, because if we don't, we leave detergent stains on them. The detergent wipes are in yellow and white packages and they're all across the wards, so please do look out for them if you are to do some cleaning. But make sure when you are cleaning you put gloves and apron on to protect your hands and your uniform. The next thing to discuss is waste. Everybody's favourite subject. The waste comes in 2 segregated bags. There's black waste and there's an orange coloured bag which is called clinical waste. We wouldn't really expect you to be dealing with the clinical waste, but the wards may ask you to take it out and put it in the locked cupboard. If they do ask you for that, then make sure you've got the code so you can get into the room. But also wear gloves and aprons when you take it out there. Clinical waste cannot touch any other waste. It has to go out on its own. Please do not carry it with anything else. And please don't let it build up on the floor. If you've got a bag of clinical waste, then please take it straight out and dispose of it. Anything that goes into clinical waste becomes clinical waste in law. So if you put a newspaper in a clinical waste bag, it becomes clinical waste, unfortunately. So please don't do that. Put anything that's not clinical into a black bag, just like your normal domestic waste. In conclusion, infection prevention control is everybody's responsibility. That includes you. We want to keep our patients safe, but also we want to keep you safe. So please do abide by the infection prevention control rules. They are simple and not difficult to do. Your work within the Trust is invaluable and we can't do without you. So please make sure you're safe. Last thing is, if you have any questions, please, we are out on the wards. Do stop us and ask us questions, because sometimes your question comes into your mind and if you don't ask it there and then, you'll have forgotten it. If there's a question you really need to ask and you haven't seen one of us, then write it down. You can ring us. Our phone number is 4882, and if you're outside the hospital, just put 53 in front of it. You can also speak to your volunteer coordinator. She can answer questions, or she will get hold of us for you. And we will be invited to some of your quarterly sessions. So again, if you want to bring questions along there, please do. Thank you very much for listening.